Hello, and welcome to The Healing Edge. My name is Yodi Williamson. After all the usual options to heal from cancer have been exhausted, where do you turn? There are a myriad of so-called cures on the internet. How do you know what might work for you? Helen O'Toole was diagnosed with a rare form of cancer that usually goes from diagnosis to death within 2 years. Helen refused to accept that palliative care was the next step. And now, over 5 years later, and well on her way to recovery, Helen wants to share her experiences of the many different modalities and doctors that have helped her to escape from the clutches of this brutal illness. And so, I would like to introduce you to the founder and producer of the Healing Edge seminars, local Vancouver architect, Helen O'Toole.
Thank you, Yodi.
Helen, what was your reaction when you first heard the news that you had cancer?
Oh, shock. One always thinks it's never going to happen to them. It was very overwhelming. You immediately go to a place of fear. The medical system here is great, however, they want you to make a lot of decisions immediately, and it is overwhelming.
Yeah, but you're still here, which is great.
Yes, I am.
Have you any idea of what might have caused this illness?
Well, my initial thought was probably when I visited New York City the night before 9/11. I went to visit an old school friend. The next day the Twin Towers came down and we were in the dust, and 5 years later both myself and my friend were diagnosed with cancer within 6 months of each other. We're not sure if that's the reason, however, those old buildings, the asbestos, lead from the batteries, PCBs, from the refrigeration units, it was a mess. And the cancers are particularly virulent. Doctors expect them to go on for the next 20 years.
Oh my goodness.
Yeah.
Not to mention the emotional shock from having witnessed such a
Absolutely.
horrific event.
Yeah.
And so after diagnosis, I know that multiple surgeries followed and eventually chemotherapy. But tell us where your mind was when later all these things had failed and the cancer was still there.
Well, multiple shock and surprise. You expect that you're going to be fixed after going through all of that horrible chemotherapy. But I wasn't, so I refused to accept the 2-year ultimatum that the doctors gave me, and I started to research. I started to check different treatments against good scientific resources. I found some that were not particularly good, that actually could cause harm. But gradually I found doctors, clinics, new modalities, older modalities that kept my cancer at bay until I found one that is working for me.
Oh, that's excellent. And what kind of treatments have you found beneficial that you're going to be talking about in your seminars?
Well, I'm going to place an emphasis on immunology. Did you know that there was a doctor that has quantified the protective coating that tumors put around themselves to hide from the immune system? The same doctor has devised a treatment to remove this coating and essentially unleashes one's own immune system to attack the cancer. I'll also be talking about this frequency healing. I attended a clinic in the UK that does sound and light therapy that gets rid of cancer cells, and some other immune boosting cancer vaccines, therapeutic vaccines, and some other things that are inexpensive and that a person can use at home that have brought some people into remission.
Well, the research that you've done has certainly paid off for you. You're still here, looking fit and very well.
Thank you.
But why have we not heard more about these various therapies for cancer that do help people?
That's a really good question, Yodi. With the advent of the Second World War, they discovered that mustard gas actually brought some people who had lymphoma into remission. Subsequently, the pharmaceutical age was born, and we've had chemotherapy since. Prior to that, there were some doctors researching immunological responses and some modalities that actually worked, but these fell by the wayside as time went on. So in my seminars, I'll be describing these older modalities and how doctors are bringing them into the modern age, as well as new discoveries.
It's interesting. The content of your seminars sounds so interesting, but sometimes we hear about individuals that do get remission from cancer using particular forms of therapies, alternate therapies, and then the news seems to dissipate. Why is that?
Well, I think in both allopathic regular medical options and alternative options, cancer seems to be a different disease in each person, and what works for one person may not necessarily work for another person. There may be a great who have, and something does work for a few people, then it fades away because it doesn't work for the majority of people. What I have found in my research that has helped me is modalities that seem to have a more universal effect and help more people.
So Helen, do you see a place for both the medical, regular medical approach and the alternative approach for people?
Yeah, absolutely. Chemotherapy does help people. Surgery is one of the best things. If you've got it and can cut it out, that's absolutely marvelous. However, people should have some choices if these methods fail, or indeed some people want to have a less toxic approach to healing. People should know that they don't necessarily have to go home to die after the usual options have run out.
That's true.
Yeah.
So why don't doctors here in Vancouver and probably elsewhere let their patients know about alternate treatments? Surely a few physicians know about some of these different therapies.
Oh, absolutely. Some of the older physicians do know about the older therapies from like the 1920s, 1930s, before chemotherapy came along. And indeed, some physicians do know about the newer discoveries as well. However, there's liability. And if a doctor suggests a particular alternative way to go to his patients, he may be sued if it doesn't work for that person. Now that said, there are some physicians that do help some people find different routes, but not all of them. So people wonder, they think to themselves, well, sure my doctor would have told me. Unfortunately, maybe not.
Well, that's actually quite shocking and also very discouraging.
Yeah.
And apart from your own amazing journey of healing, what initially gave you the impetus to start these educational seminars that you're embarking on?
Yeah, that's a good question too. I was in the cancer agency, which is the main cancer hospital here in Vancouver. In the hallway, I met this woman who was standing there shaking, holding onto a counter. She just got that terminal news, the news nobody wants to get. The news, go home and get your affairs in order. Otherwise, she was standing, she was healthy, she was in shock. All her options had run out, and she thought, I'm going to die. I started telling her lots of things, doctors that she could call, places that she could go. I didn't have time to give her all the information. People have a right to know that there are options out there.
But, I think that your seminars are going to be so inspiring and so filled with hope for so many people, and I'm so grateful that you came and told us about this today. So
Thanks,
thank you
Yodi.
very, very much, Helen.
Thank you.